Hello, class. Welcome to the spring 2021 contemporary health class. I am sure this year as a whole has been a real challenge, and I hope 2021 is going to be a much better one. Again, we are faced with COVID-19, and one of the things that I would like us to spend some time, especially with the first class, is to really make sure that I'm sure most of you have heard about COVID, what it can do, but now is what can we do so that we don't have COVID? Because the outcomes have been very destructive. This virus has caused so much pain and continues to cause so much pain, so much loss. Please make sure you know those ways to prevent yourself from being infected with this disease. Please use the mask. Wear your mask. If you can, maybe depending on the type of mask you have, wear 2 at a time so that you create a very strong barrier so that those microbes, those droplets cannot get into your nostrils or your mouth. Please, don't listen to those who are trying to assume that they know how to get rid of this virus. So far, the only way you can is to prevent you from getting it. So wear the mask, keep that distance, especially for people you're not familiar with. Keep the distance. And also, in addition to keeping the distance, try and make sure that you wash your hands as often as possible. Especially when you try things that have been touched by others. That's extremely important. You wash your hands and avoid crowded places, especially people you're not familiar with or people that are not from your household. And also, if you can, don't travel. If you travel, you make sure you wear the mask and do those other things. So, because until we have the vaccine, until we've been vaccinated, and even then, we still have to do all those things to keep us healthy. And please, convince family members when is their time for the vaccination. Please convince them to go get the vaccination. I know public health has not done right by especially our people for quite some time. But today is a new day. People are watching whatever people do. So try as best as possible to convince your relatives, your grandma, your grandpa, your uncle, your aunts, your mom, your dad, to take full advantage of this vaccination when it's time for them to be vaccinated. Okay, contemporary health. What is much more contemporary today than COVID-19? It has been with us for quite some time now. It's almost getting to a year. And we've seen what what it has done. And in the process, we've seen some of the inequalities within the health system. How some people have been treated with more, when it comes to service, have received service in a much better way than others. Again, these are all things that we will study in this class. And what I want you to really be aware of is I want you to learn the information, learn the skills, get all the knowledge that you can from this class, and see what you can do to improve your own health and also the health of family members. This is not a medical class. This is a class providing information, where to look for information. Because most of the time when you have information, as people say, information or knowledge is power. So when people have the knowledge and they use it the right way, that can help to improve their health. So take your time, read the textbook as much as you can, because this is a very, very good textbook. We will not do justice to this textbook with under one semester and under all these conditions. But if you take your time to really read this book, understand some of the things, and also ask questions, you will leave this class with some information that will be very, very, very helpful to you. As I always tell my students, the grade is important, but most of the time, the most important thing for me is, have you really learned something from this class? Are you going to use what you've learned from this class to at least help you deal with some health issues, so that you can know to ask questions, know when to go to the doctor, to the hospital, know when to tell your family member that, dad, uncle, you need to go to the doctor. You see, because if you don't have access to information, to knowledge, then most of the time you don't know what access or what area you need to access for service. So please, let's make this one of those things that all of us are going to agree upon, that we will get as much information from this class and we'll share that information with family members when appropriate. And do the best that we can. At times we have more rights than we think we do. But if you don't have the information, most of the time you think you don't have rights. So going back to health, what is health? If somebody asks you, what is health? Most of the time it's You can define it, or you can say what health is, what health means to you. And if I ask about 5, 6 people what health is, I am sure I will likely get about 5 different answers. And maybe one of the most common is the physical health. I'm sick, I'm not sick. I'm having a headache, I don't have a headache. Or depending on what is affecting the individual. But health in itself is much more encompassing. It's far more than just the physical. It's also emotional. It's also spiritual. It's also intellectual. So when you define health under those variables. And at times also, your health also can be influenced by where you live. Do you live in a place that is polluted? Because that has an impact on your health. Do you live in a place with no resources, no good food, no clean water? Those are all things that can impact your health. And what are some of the cultural beliefs that we practice within our families that may not be the good source of health? You see, because health alone by itself it's almost like a big word, a pregnant word. Depending on what you want to really derive from it, you can, because health is the way you feel. And in most cases, especially when you think of the present situation that we're dealing with this coronavirus, the COVID-19 virus, how many people deal with anxiety? How many people have almost lost hope? One day they were employed. The next minute, the job is gone. One day they can provide food for their families. Now they cannot. So this COVID virus has provided a lot of, when you think of trauma, when you think of sense of hopelessness for most people, and depending on the communities in which they live, because some people live in certain communities wherein they care for each other. They share whatever they have. Are you living in that sort of community? Or are you living in a community which is each one for his own? Those are all issues that impact our health. Level of education. Do we have enough level of education that can provide us a well-paying job? Because it's getting to the point, even with your first degree, depending on what your area is, might be a challenge down the road. See, because education provides access. A good education provides opportunity. And also, do you have health care? Do you have insurance? What type of health care do you get? Because the type of insurance most of the time will also determine the type of health care you get. You see, America is almost like it's really hard to explain, when you think of all the resources that this country has, the know-how, and yet still you still see the amount of suffering that people go through, or the amount of suffering that people experience. So you down the road as a professional health educator is to be an advocate for those who don't have. Remind those that have that it's okay if they can share. See, the word sharing has become a kind of a very, for some people, it's almost like you've just used the worst word, for yes. If you have, you share with those that without. And also, where the neighborhood in which we live, as I said, what sort of people are in your neighborhood? Do you know each other? Or we are just in the same neighborhood. Next, we can be in the same building, but you don't know each other. See, we are social beings. We need to know each other. We need to spend time talking to each other. That in itself helps with health related issues, with your thinking, with your psyche. The environment, what sort of environment you live in? See, because again, the environment can also be a problem. If you live in a toxic environment, you have the chances of developing all sorts of respiratory issues, cancers, all type of cancers, and all sorts of health related complications. And most of the time, it's the underserved, the poor people that live in those toxic environments, wherein you have these dumps, wherein, the stench of the place alone. And yes, when they think of the issues wherein there are disasters, those who don't have are the ones, are the last to be rehabilitated. And some will never. Think of hurricanes. Those who have can easily get back to normal once everything stops. They can build their houses, build it even better or in a much better place. But those without cannot. and at times cannot even be able to build. Just like with the fires that are going on in other places. See, the health related issues, when we talk of health, we are not only talking of health for people with means, we're talking of health for people without means. What is the community doing for those people? What is society doing for those people? What is the nation doing for those people? So COVID-19 has clearly explained or exposed America in at the worst of light. Because for quite some time, people have been talking there are two Americas, the haves and the have not. COVID-19 has just further explained that, exposed. So health can mean different things to different people. But at the end of the day, health has to be something that collectively the government has to make sure that they provide all necessary support for their citizens. Come to the state, same thing. Come to the local communities, same thing. They have to provide those conditions or create a conducive living environment where people can experience good health. So here, when we're talking about health, to explore the complexities of health as a concept, this is what I've just been talking about. Complexity is far more than just, oh, my belly ache, tummy ache, or whatnot. It's far more. There are so many other factors within the society. What is the social climate in which you find yourself in? Are there community resources wherein people can go for help, for service? What are the attitudes of people? Because there can be services, but if the people that are providing the services have negative attitudes, most of the time it's likely that people might not go for those services. And this is one of the issues. Even right now, some people are kind of not too sure how much should they trust the government in terms of what they are saying. Because the overall government, the intention of the government might be great, but people at the grassroots level that provide the service might have attitudes that are so repulsive that those people who might need to seek those services might just stay away. So most of the time, resources alone by itself is great, but we also have to make sure that those people who are providing the services are, first of all, are culturally competent, are people with a conscience, they have empathy, they respect others. Yeah, they might be poor, they might be sick, but they are human beings just like anybody else. And therefore they deserve the respect. Okay, and to reflect on your own perspective of health, because it's also good, Most of the time we hear what people say about health, about health, about health. But what is your own perspective? You have to know. Again, somebody with a job that pays well, most of the time have a roof over their head, can provide for their family. But when you think of the jobless, people without job, meaningful job, the homeless, and you see people living in houses that most of it is just space for one, two, three people. And those, the homeless, are being driven, being thrown away because they create embarrassment. So as we continue with this, the definition of health is dependent on a wide range of perspective, as I said. Some of them can be subjective. It's your own feeling, the way you think about it, and also experiences, people's personal experiences. And these are things that are socially influenced, the society, the culture, and some of it is historical, as I said, the Tuskegee, and how people, people are being treated. You go down history, you have so many stories that at times you almost want to pull back and say, how could these people really be talking about all sorts of, oh God, or this or that, and treat their fellow men this way? And again, as societal norms continue to improve, things get better. History, with the advancement of technology and the research and more people really diving into really health, different respective health issues and different specialties, yes, things have become much better. It's a shame that now COVID-19 is killing people, killing that many people. But before then, infectious diseases were only killing people way back. But in the 20th century, no, infectious diseases were not the leading cause of death. The leading cause of death was chronic conditions. People's diseases that are slowly developing through people's either lifestyle or history. Things like cancer, hypertension, and diabetes, and all these other those are diseases that are not transmitted. They are non-infectious. Somebody with cancer cannot give cancer to somebody else. But unlike cold, somebody with a cold, because of the microbe that causes the cold, they can pass that cold to somebody else. So these are all advances that have taken place. And some of these things are culturally located. Health is an abstract concept. It's a concept that is far more than we think. There is no universal definition that everybody can say, okay, when you say health, this is what it means. But all the same, for today, I'll end, since this is the first lesson, I'll end here and start thinking about what health is. And if you can, try to see either you Google it or find out what are the social determinants of health. Social determinants of health. Find out. And let's discuss it as we progress with the class. Because once in a while, some of those determinants may present themselves in other chapters. Because one thing about health is just not caused by one thing. There's a variation of various things that contribute. Somebody's health is poor. It's poor because of where he lives or she lives, the environment, the social construct, the resources that are available to that person, and you can go through the whole list. So it's not only one thing that really leads to the disease or the poor quality of health. There are multiple variables. Okay, so again, stay strong. I know it's challenge. This is a challenging period, but you can do it. Stay strong, work hard, and stay safe.